Hi guys, welcome back to my channel and thank you so much for tuning in once again. So in today's video I decided to list a few things that student midwives should never do, because these things could possibly get you into a lot of trouble and it could also mean that you will get kicked off the course. So I'll be listing a few things that you should never ever do as a student midwife. So without further ado, let's get into this video. So the first thing that you shouldn't do as a student midwife is argue with your mentors, CPFs or colleagues, either on the wards, off the wards, in the break room. Just arguing with them is a no. You don't want to be seen arguing with your mentors, your CPFs or your colleagues. When you are working in a professional setting, you are expected to respond and react in a professional manner. So if you are seen arguing with your mentors or your colleagues, then you are going to be perceived in a certain way. People are not going to want to interact with you. People are not going to want to talk to you. People are just going to start avoiding you. And you just need to be mindful that the people around you are soon going to be your future colleagues when you qualify and become a qualified midwife. So you don't want to be seen having arguments with your mentors, with your CPFs, with your colleagues, because all these things will be added to your record. It could also be added to your progression papers, so your pads, your papers that you need to get signed off. They could also be noted that you've been arguing with certain people, and then these notes will be taken back to your university, and then things could progress further, and you may even be kicked off the course if you're consistently arguing or making fights or making things awkward for yourself and others at work. So that's the first thing that I would suggest, is never to argue with your mentors, your colleagues, your CPFs while on placement, or even your tutors while in uni. Just avoid that altogether. You don't want to be seen in a negative light, because these people will be your future colleagues as well, and you will have to work with them, and you will need to gain their respect in order for you to work with them. So if they are seeing you in that light from the beginning while you are a student, then your journey while you're qualified won't be as smooth and as safe sailing when you're qualified. So the next thing that a student midwife should never ever do is miss your shifts and not notifying anyone that you are not attending that shift. So what I mean by this is, if you are allocated to be in a certain amount of days and you just think, oh, I can't be bothered to go in today, I'm just going to stay at home and do, you know, independent learning or independent reading, and not tell your mentor or your CPF that you're not coming in, that is a no. That's a bad move, because one thing that's going to happen is that they will find out that you haven't been in, and then you will be seen as irresponsible, you will be seen as not being professional, and you will just have like a red mark on your name. So next time when you are applying for a position at that hospital, for example, if you are applying for a position at the hospital, they won't give you a job because you were constantly missing work, missing shifts, so you weren't acting in a professional manner. So why would they give you a job? Why would they give a job to someone that is constantly missing shifts and lying about it and not informing them? So they won't offer you a job. So that's one thing you should never ever do. If you're allocated to work, show up for your work, and if you can't go, say for example you're sick, a family emergency, something's come up that you can't make it to your shift, call them and let them know and be professional about it, rather than not turning up and sitting at home doing nothing. Or, you know, you can actually be productive and be reading, but just let them know that you can't come in, rather than just missing shifts and lying about it and not telling them that you've missed a shift. So another thing that a student midwife should never ever do is give medication without your mentor present or a qualified midwife present. So what I mean by this is, your you could be in your 3rd year, for example, and you're very confident in giving medication. You've been giving medication for the last 3 years now with your mentors, and then your mentor is like, you know what, I've worked with you for so many shifts, I know you, I can trust you, can you do my drug round on the first day? I'll be sitting here doing my documentation. And then you're like, okay, that's fine, because you've seen her do it so many times, you've worked with her, and you go and give the medication while she's sat at the midwife's desk, and you go and do the drug round. That's what I mean by never give medication without your mentor, even if you're told to give the medication without them. Never ever do it. The reason why I say you should never do it is there was an incident at my hospital where a student gave a medication because a mentor told them to give in a medication. It was an injection to the woman. The mentor wasn't there, so she wasn't there, but she gave the student the okay to give this medication to this lady. So the student midwife goes ahead and gives this IM injection to this woman, and then finishes and everything else. The next thing that happened is this woman comes out shouting. She's shouting at the midwife, nearly hitting the midwife, saying, you've given me the wrong medication, you've sent your student to give me the medication. So basically there was a huge deal over this, because the woman was now saying that no one asked her for her consent to give the medication. She was saying that no one told her what the medication was. She was saying that she never wanted the medication and things like that. And she also said that the student gave her the medication. So do you see the mess that now brought this midwife in? Because obviously the midwife wasn't there. She just told the student to go give the medication, and the mentor wasn't there present. So obviously this student got into a lot of trouble. She went against the rules of giving medication under supervision, and she got herself into trouble, even though her mentor trusted her, even though she was a 3rd year student and she was very good. She went and done something that she was not allowed to do. So that's one thing I say. Never give medication without a mentor or qualified midwife present. Anything could go wrong. Anything could happen. Always ask to be supervised if you are given medication. If your mentor says she's too busy and she trusts you, say no. You need to stop what you're doing and come with me and observe me giving this medication. Never just say, yes, I'll go and give this medication and go about your business and do it yourself. Always watch your back, because at the end of the day, it's your practice. It's you that will get kicked off the course if they find out, or if something goes wrong. It's you. And obviously the midwife is her pin. She will also lose her pin if anything goes wrong, but also yourself as well. You may just be a student without a pin, but something could go wrong. You may get kicked off the course. So that's the next thing, is don't give any medication without your mentor or a qualified midwife present. So the next point is, you should never turn down opportunities while on placement. So if someone comes to you and says, we have a forceps delivery in theatre, and we have a Braddy as well in theatre, hence why we're doing the forceps delivery, trying to get baby out and things like that, and they say, do you want to come and observe and assist with this delivery? Never ever turn it down. If there's an opportunity being presented to you, always receive it and go and take this opportunity when you can. So the reason why I say never turn down an opportunity, because the 3 years of you training is going to go by so quick, and there's so many things that you won't be able to see. But if there's so many opportunities coming your way, make sure you grab those opportunities and take them while they are still being offered to you, because there are so many things that you will miss. You will end up being qualified and being left on your own. You need to see as many things as you can before you are qualified. So use that opportunity and seize that opportunity, and make sure you see as many things as you can. Never ever turn down the opportunity to learn or gain a new experience in something. So the next thing a student midwife should never do is never give your personal information out to the patients or the clients. for the women and their families. Never give out your own personal information to them. So for example, never give out your phone number to the women, never give out your address to the women. There was a situation when I was a student midwife and a friend of mine gave her number to a woman because we had to collect caseloading women. So we had to follow women antenatally, during labour and postnatally. And so she thought it'll be easier if the woman calls me directly when she goes into labour rather than calling the hospital and then finding out if I'm on shift. Because normally what we used to do is, if you're caseloading a woman, you would put a sticker on her notes and your name, so that when she is in labour, the midwife that's looking after will call and notify the student, depending on the sticker, that the woman is in labour and you get called in. But my colleague or my friend decided to give her own personal number to the lady, and what happened was the lady would call my friend at random hours of the night saying, I have this issue, what should I do, what should I do, what should I do, what should I do. Like, she would call my friend constantly with problems, with things that were going on in her life and things like that, that she then had to escalate it to her mentor and her CPFs, and they were like, why did you give your number away? You were not supposed to do that. That's breaching our guidelines and things like that. So never ever give your personal details out to the patients while you are on placement. You just need to keep that life separate, keep it professional, and make sure that if they want any contact numbers or any numbers to get hold of, like out of hours numbers and things like that, always give them the hospital number, give them the triage number. The triage is a 24-hour service. They can call morning, night, day, Monday to Sunday, whatever time. So give them the triage number. And if you're not sure, ask your mentor which numbers to give the women. Okay, so never give out your personal information out to the mentor. It's also a nice peace of mind that you're not having to be woken up by women calling you and texting you and asking you questions that you yourself can't answer, and you don't want to be also giving them the wrong information, because if they now go and do something with the information you've given them, then they're going to come back to you and they're going to say, why have you told them this? And why didn't you send them to triage or to labour ward or things like that? So never give out your own personal information to clients. So the next one is never discuss patient information outside of work or to people that are not relevant within the patient's care. So what I mean by this is discussing the patient or the client outside of work, maybe with a group of friends, outside of work, in a coffee, in a restaurant. You never know who's sitting next to you in the next table, that they may know that person, they may know that name, and you talking about them is breaching confidentiality. So never discuss a patient's personal information outside of work, and also question everyone that is asking about your patient. So if, for example, if you have a new doctor on the ward and you've never seen this doctor before, and they come to you and they ask you for information about your women, you need to make sure that this person is actually a doctor and has the right to know this information. Don't just give out personal information or personal details about your women without making sure that the right person is hearing this information. So don't discuss them outside of your workplace, because you never know who else is listening, and all the patient information is confidential. And also while at work, make sure that it's a need to know basis. So does this person need to know? Who is this person? Do they have right to receive and hear this information? Just make sure that the information of the clients and patients are kept confidential at all times. So another thing to remember is never hold a baby without maternal consent. So this one is a big one, because obviously babies are cute. You see them, you want to hold them, you want to cuddle them, you want to touch them because they're so cute. But never hold or touch a baby without maternal consent. If you walk into a room and someone has just delivered and you see the baby in the cot, always ask for permission. So ask for verbal consent. Say, is it okay if I pick baby up? Is it okay if I do such and such? Is it okay if I do this? Do you need help with changing baby? Do you need help with feeding baby? And just get that verbal consent before you do anything. Whether it's holding baby, whether it's changing baby's nappy, whether it's feeding baby, whether it's assisting with breastfeeding, always ask for consent before doing anything. Even if it's to do with mum, whether you are helping mum change, whether you are helping mum to breastfeed, whether you are taking out a cannula, always ask for consent before doing anything. You don't want the mum to go around and complain about you that you just picked up her baby, or you changed her baby, or you fed her baby, or you touched her without her consent, because then that will turn into a real problem. So always seek consent before doing anything towards the baby or mum. So the next one is, don't go on your breaks longer than your allocated times. So for example, if you are given an hour of break, take the hour. Don't take an hour and a half. Don't go and take 2 hours. If they have given you an hour, take an hour. So you need to remember that you need to act professional. These people will soon be your future employers. So you will be one of their employees. So in order for you to get a job with them, you need to act professional for the 3 years that you are going to be training at their hospital. If the mentor tells you you can go on a break and go sit on a break for an hour, make sure you come back within that hour. Don't take too long. Don't take 2 hours. Don't take an hour and a half. Make sure you go and take your allocated time. So the next point is, don't make mistakes and lie about them or cover them up. So mistakes can happen. We all know mistakes can happen. Mistakes happen all the time. But if you make a mistake and lie about it or hide it or try to cover it up, it's a big no. Especially when you have been witnessed making the mistake and you try to lie about it and cover it up, it's a very big no. If you make a mistake, just put your hands up and say, I've made such and such mistake, I'm sorry, can we try and, reflect, tell me what I did wrong, tell me how I could do better, and things like that. Never ever try and cover up a lie or cover up a mistake, or you will look like such an unprofessional person. If you are ever caught in a lie, if you are ever caught covering up a mistake that you've done or you've made, they will never want to employ someone like that ever in their life. Someone that covers up mistakes is someone that they will never ever want to employ. That's someone that's not professional and is very unreliable, and someone that's a liar. So they won't want to hire someone like that. So if you ever make a mistake, just make sure you don't lie about it. Make sure you don't try and hide it or cover it up. So the last and final point is, never ever take pictures of the babies or of the mums and the clients, the families, without their consent. Or even if it's with their consent, I would try and avoid it, because they will give you their consent to take a picture and then turn around tomorrow, next week, next month and say they never consented for that picture to be taken. Unless you have something in writing, unless you have witnesses of these conversations, never ever do it. And especially when there's no consent involved and you're taking a picture of a baby and you're posting it on social media, or you're taking a picture of a mum without her consent and posting it on social media, that is a straight no. Always seek consent, and even with consent, be careful with it, because they may turn around and say they never actually consented. So is there a witness? Have they actually written something down? And why is this picture that important for you to take? Always think, is it worth it? Do I really need this picture? why do I need this picture? And whenever there is no consent, never ever 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 do it, because that is something that you could get kicked off the course for. That is something that you can go to the courts for. So the law, you'll be facing the law if any picture of a baby ever faces the internet and you have taken it without their consent. You can go to court for that. You can lose your practice to work for that. It's a very 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 big offense to take people's, especially babies, without maternal consent or parental consent and put it on the internet. So always 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 seek permission, and even with permission, think, do I need this picture and why? And is there a witness? Can my mentor be there so she can document? Picture taken with maternal consent at least is written somewhere that can be proven. But even still, I would just avoid taking pictures of babies and mums altogether, because it can just build problems and you don't need that kind of stress. You haven't even started your career as a midwife and you're adding on, you know, stress that is not needed. So yeah, that is the last and final point of things you should not do as a student midwife. I hope you guys have enjoyed this video, and I'll definitely be seeing you guys in my next video. And if you haven't hit that subscribe button, be sure to hit that subscribe button and join my YouTube family. Until then, I'll see you guys in my next video. Bye guys.